Is violence normal with dementia? It can be very normal. However, we can reduce chances of it. Now, some of the types of dementia are more prone to having violence than others. We have the frontal temporal dementia, which presents with more aggression than the rest of dementias. That doesn't mean the rest of dementias can't have aggression and violence. And one of the reasons that we can't take our loved ones personally is because their brain is ill. Our loved ones can't help their reactions. Therefore, we have to anticipate their reactions because they are suffering from a brain decline. We have over 100 types, and with the chronic dementias, the most common ones are four types, which are basically Alzheimer's disease, there's vascular dementia, there's Lewy body dementia, and there's frontotemporal dementia. Remember, dementia is symptoms. Dementia is not a disease. With the violence and aggression, is there something as caregivers we can do about it? And the answer is yes. A lot of times there's something we can do about it. And first and foremost, talk with your doctors about it, because if there's extreme aggression, if there's extreme violence, you can't take care of someone who is kicking you and biting you effectively. Therefore, talk with your doctors and see if there's something that would work for them to take a medication to calm them down so that you can take care of them. And remember, medications have side effects. One of what happens with families is that they put their loved one on a medication, and a lot of medications that are geared towards behavior will cause someone to sleep more or to be more lethargic, where they are just not themselves. And we don't like that. So then we take away the medication and then the violence comes back. So you need to, first of all, emotionally deal with the changes that are happening to our loved ones. We need to come to a place of acceptance. What is happening is real. Accepting a condition doesn't stop God from working. But to be effective in caregiving, to be effective even in getting the right treatment, we have to accept that there's a problem. And with chronic dementia, it does not get better because the brain starts to decline. The physical brain starts to decline. It doesn't become better. It can be slowed, but it will definitely end up declining and getting worse over time. Even as much as we try to slow it, we can't stop it from declining. So just be aware of that. Is we make the best efforts, but at the end of the day, chronic dementias come worse over time. Okay, what about our part as caregivers? Now, these aggressions are caused by certain things. Number one, there is a decline in their brain, which causes them to be disoriented, to have inability to recognize people, places, and therefore your loved one is feeling vulnerable. They are feeling vulnerable when they don't recognize, even if you're the one, as a wife, as a family member, they've known you for years, but the brain is declining. So over time, they will not know who you are. And so they could strike at you. It's because they are feeling threatened, because in their world, they don't know who you are. And so, how we approach them makes a big difference in how they respond to us. Always approach from the front or the side where they can see you, and announce yourself as you approach. Talk, let them know you are coming. Also, as you are caring for them, tell them what you are doing. I'm going to put your eye drop. I'm going to give you breakfast. Don't just show up and surprise them, because that makes them feel very vulnerable, because that's what their brain is able to handle depending on the progression. And then there's the communication difficulties, where they are trying to express themselves and they are not able to express themselves. So they are trying to say something that they are not able to say. They can't find the words. And so they feel frustrated. And sometimes they will resort in striking, or cursing out, or yelling. Why? Because they are trying to communicate and they are struggling with communication. There's also physical discomfort. So if your loved one is in pain, they are most likely to strike at you. They are most likely to speak angrily towards you. And with dementia, they are not very good advocates for themselves. So we have to get to know them well, so that we can advocate for them, so that we can try to anticipate, figure out what is causing them discomfort. If they are incontinent of bowel and bladder, or one or the other, we have to keep them dry. Change them. Don't let them sit wet, because that makes them uncomfortable. And then they'll get angry because they don't know why they're feeling uncomfortable. Sometimes they'll have pain, and we can judge pain if we see them grimacing. You see, they grimace, and you can see folds on their faces, or you can see them tighten their fists, or their bodies are very tense. They are very tense. They are trying to handle the pain that they are feeling. And therefore, being on top of their pain, give them, if they have pain medications, don't wait to catch up with the pain. Give it as it's scheduled. If they start to develop pain, or it's PRN, you're giving them as you see pain, then be quick to recognize when they start grimacing, when they start clenching their fists. Be quick to recognize that, so that you can give them the medication, to prevent them from being too uncomfortable to where they start hitting, striking, yelling, calling names. Because oftentimes, I have had families say, my mom was so calm and so kind. I can't believe the things that are coming out of her mouth. Well, she was comfortable. She was able to get her own medications if she was in pain. She was able to know what's going on and take care of herself. And now they are not able to do that. And so sometimes we'll hear words and we are able to control our emotions, but when there's dementia, that goes. And so, whatever words come, you hear people speaking, and sometimes we think, oh, these people are horrible. They must have always been horrible. But the fact is, we all have negative thoughts, but we are able to control ourselves. When they have dementia, they are not able to control themselves. So things are going to come out of their mouths that are going through their thoughts, unlike when we can control. So always making sure they are comfortable. Another one is checking for the triggers, the environment. Are there places that you bring your loved one and you realize they are all of a sudden uncomfortable? So avoid those triggers. Maybe it's a lot of people that are around. Avoid the triggers. Sometimes it might be that you need to separate your loved ones. Maybe if you have visitors, like I like to have visitors when I can, And I've noticed that my dad doesn't cope very well when there's people around. And so, is there a space that you can separate them? Maybe keep them busy. I like to turn on the Wero TV, the Kimeru TV for my dad because it keeps him entertained while I am having my visitors. Now, here's the thing for caregivers. Don't stop living your life because you are a caregiver. Because what I've seen as a chaplain of many years is a lot of caregivers become very resentful. Why? Because we give up our lives to take care of our loved ones. Don't do that. You're not required to give up your life. Make sure you are meeting with friends and just getting out of the environment to give yourself a break. Otherwise, you become agitated, you become resentful, and that is not good for your loved ones that you are trying to care for. I'm a caregiver. I have visitors. I hang out with friends. I still do my best to live my life because at the end of the day, I don't want to look back and say, well, I didn't live my life because I was a caregiver. So I'll talk more about that because I have cared for my son since he was born. It's over 20 years now of medical condition, and I've learned to live my life and trained him to live his life because if we let the conditions we deal with control us, then our life bypasses us and we become bitter. But we can fight with it and still live our lives. We're looking for triggers, and then there might be psychotic issues going on. Dementia is not madness, it's not insanity. However, somebody with dementia can have a psychotic problem or a mental health problem. Therefore, those should be identified and taken care of. Now, are there signs that tell us that our loved one is about to become aggressive? One, the frowning, the clenching, the scowling when they start to fold their face, fold their fists, muttering, yelling. There's the pacing. When they go back and forth, restlessness, agitation, they are moving constantly. You can tell they are very restless. That's a sign that they are getting agitated and they could become violent if we don't take care when we see those kind of behaviors. One of the first things is number one, you always want to remain calm. Don't join the restlessness. Many times we can get into a place where we find restlessness. As a chaplain, I could go to places, sometimes it's people's homes, at times it's facilities or hospitals. But you go to people's homes, and sometimes when you enter, you can sense the atmosphere. It's heightened in there. There's a lot of anxiety in there. You can look at the people and they are very anxious. And sometimes, if we are not self aware, we can let this anxiety take us and we become anxious like the rest of them. Then we are not effective. So, as caregivers, we always need to plan our responses ahead of time, and we need to be very self aware. So, if you are in an environment where there's agitation, the first thing is to say, I'm not going to get agitated. We have to constantly make these decisions in our mind. So, staying calm will help you be more effective with your loved ones that are agitated and restless. Make that decision. I'm going to stay calm. And then you stay calm and don't let them bring you down because then you can't bring them up. So make a decision to stay calm, plan your responses ahead of time, and then try to figure out what are the triggers, what could be causing the behaviors. Identify the triggers so that you can take care of those triggers. You also want to keep reassuring your loved one, reassure them that everything is going to be okay. Put a smile on you, a kind smile on your face. Don't let them judge you to be laughing at them, because that can make things worse. So look them in the eyes, speaking to your mind calmness, and speaking to them calmness through your eyes. It is gonna be okay. We'll take care of the problem. What's going on? Can you tell me? What are you feeling? And talk in a low, soft tone to them. Even if they are yelling, don't yell. Stay calm, speak calmly, look into their eyes with kindness, because they can see that. They can see what's going on in you. And that will help them trust you more and be more calm. And then just making sure that you give space, don't get too close. If someone is pacing and they look agitated, please don't get too close, because that's your invitation to be hit. Just give them space, and then reassure them that you are here to help them. Tell them who you are. Even though they don't know, you can just say, I'm so and so, I'm your daughter, I'm going to take care of whatever is bothering you. And just say it calmly. Remain calm with a smile. Don't show them you are scared, because if you fret, they can see it and it doesn't give them comfort. And then always making sure that their basic needs are met, so that you're not catching up on what's going on. All the time when you are dealing with your loved ones that have dementia, basically make sure they are safe. Take away knives, take away sharp objects, take away cords from the floors, because they can trip and fall and get hurt. So things that are harmful, put them away and seek help. Sometimes it might be that you need somebody else to come and sit with your loved one so that you can take a break. Do that. But there are many things that we can do to avoid our loved ones from becoming violent, even those with frontotemporal dementia. Our approach can calm down a lot of violence. So be calm, seek help, have other people sit with your loved one so that you can take a little bit of break. And caregivers don't like to ask for help. Sometimes we feel like we are bothering people. I watched my mom really, really struggle towards the end of her life, still trying to take care of her husband with dementia. And I would tell her, Mom, caregivers die and they leave the person they are taking care of. I could not get through to my mom. She just really believed she had to take care of my dad. And indeed, my mom died. It's been 2 years now since my mom went to heaven. So, caregivers, trust other people to help you. Then you can do better for your loved one. When you wait until you are too agitated yourself, then you are not able to control your emotions and you don't end up becoming the best of a caregiver for your loved one. So take breaks, have other people care for your loved one so that you can do better as a caregiver. So violence with dementia can be very normal. Agitation can be very normal. We should expect it so that we can avoid it. Expect it so that you can avoid it. Approach in a way that will minimize chances of violence. And last but not least, seek help. Seek help. I started with it and I'm ending with it. Seek help from your medical professionals. Seek help from your families. Seek help in caring for your loved one, especially if the frontal temporal dementia can be tough because of the violence, the kicking, the hitting, the yelling. have somebody else help you sometimes so that you can take break. If your loved one has a lot of behaviors, go for medication and get someone else to help you. God bless.